Okay, I'm Christine, your pediatric feeding expert. I'm here to go over ideal teething toys to help properly, help babies explore their own oral motor skills. And I want you to put obviously on your registry the things you're going to probably be using most and explaining to you when to use them and why. Okay, so let's get started. So teething toys in general, I would say people might have a preference about the material used, but I'm more concerned about the shape used. Okay, so the material itself doesn't really matter oral motor wise. There are some things that have some textured spots here, like you can see these little raised bumps on this toy here. Yeah, that's all well and good. It does give baby some different textures to play around with, but that's not quite as important as the shape. Okay, so the shape, so anything curved like this, you see how there's like more rounded edges here. Okay, there's also, right, this is very rounded here. This is a natural rubber one, right? These are going to be good for 0 to 6 months. Okay, so that's called generalized mouthing. So babies putting things in more of the front of the mouth, and that's okay between 0 to 6 months. Now, what happens at 6 months is ideally that is when you would begin solid food feeding. And at this point, we want to encourage something called discriminative mouthing, which is different from this generalized mouthing. So we want at the 6-month mark to start teaching baby to put things towards the back on their molars and be biting there, because that's where we do the most biting for food. So this is a great one. You see how it has these little nubs here so the baby can hold it and then start to chew on the ends right at around that 6-month mark. Something like this, the Fluxy. Now at 6 months, some of these sticks are going to be a little bit too long, right? So this is actually better more for like 8 to 12 months because of the length of it. It could go back a little bit too far. And although it's not dangerous, it might make baby gag and feel uncomfortable, right? Not a bad thing if that happens. Just saying that these are a little long for that starting at the 6-month mark. But something with these nubs that are a little bit on the shorter side are great to start. So I definitely have this on my registry as well. Something like this might also work with a small nub. I do generally avoid these hollow teether tubes. I don't find much value in them. They're very long. Yes, they have different textures, but we actually want something that's a little bit firmer, which is like these silicone ones that are not hollow. I much prefer that because we want to start building babies' muscles for chewing there. And I don't think, things like this, they just don't do much for me in terms of building that skill. So they're cool to look at. A lot of people have them, but I don't see that being really a good oral motor, skill to learn there. This is fine. It has these little nubs on the end. Again, at 6 months, that's where you're going to want to focus. And then 0 to 6 months is going to be more of that circular shape for baby. Okay, but you can see here that baby is actually putting the teether right back on that molar area where they're supposed to. It's about the size of a baby's finger, so it's not going to go too far back. Also, if you choose not to do teethers, I would encourage you to let babies chew on their finger. It's a good thing. They are practicing their oral motor skills. And even in terms of getting the germs, they are bringing in some germs to their body, but they're diversifying their gut a little bit and hopefully making their immune system even a little bit stronger. So I wouldn't freak out if babies are biting their fingers. It's completely normal and actually pretty healthy for them to do so and to practice with that. So this is my favorite one, the Komotomo one at the 6-month mark. Really any sort of ringed teether would work 0 to 6 months. Something like this would be a good 0 to 6 months. You can see babies putting it right in the front of the mouth And again, back to this, when baby's a little bit older at the 6-month mark, we want them to start moving and putting things on the side of the mouth, not in the front any longer. So at 6 months, I would discontinue giving them any teethers that are rounded and only giving them teethers that have these little sort of nubs on it to practice. And again, when this becomes a little bit too small, you can move to something more like this Fluxy, which is a little bit longer. It gives different textures, and they could really bite and practice and putting that on that back because, you know, they're going to be starting to get teeth. So when they're teething, nice, hard, chewy things like this are going to feel pretty good to them. Okay. So those are my top recommendations for baby teethers for your registry.